Think you're getting overcharged for healthcare? The government thinks so too, and now they're doing something about it. Today, we're diving into something that hits home for all of us, the extreme cost of healthcare. If you've ever felt totally lost staring at a hospital bill, or frustrated trying to figure out what your insurance will cover before you get that medication or agree to that procedure, you are certainly not alone, and this update is for you. So here's what's going on. CMS, that's the Centers for Medicare and Medicaid Services, just made two big announcements. And the second one matters whether or not you're currently on either of those programs. So first, they're ramping up their audits of Medicare Advantage plans. If you're on Medicare Advantage, you may have been overbilled without even knowing it. But starting now, the government is going after those companies hard, and this could mean lower costs for you. As you probably know, Medicare Advantage plans are private insurance plans that manage Medicare benefits. And there are over 20,000 of these plans in existence. Some of them are great, and some of them are not so great. Some of them have been under fire for years for possibly overcharging the government by as much as $17 to $43 billion per year. Yes, billion with a B. That is a huge chunk of money that could be going toward real care instead of disappearing into corporate profits somewhere. And it's hard for the government or even you to keep up with all of this because, like I said, there are a ton of different Medicare Advantage plans, over 20,000 of them across the country. All of those plans have different benefits and drawbacks and cover different things in different ways, and it's a lot for anyone to handle, which is why I'm so grateful to our sponsor chapter because they will go through everything and help you choose the best plan for you and make sure that you're not getting ripped off. You just have to call the number that you see on screen. And in the meantime, CMS plans to audit every single plan every year starting now. They're also using smart technology and hiring thousands more people to double-check records and make sure that these companies are actually being honest about the care they're billing for. This could help you make sure that your Medicare Advantage plan is playing by the rules. No funny business, no overcharging for care you didn't get, and so on. And if they find mistakes, the government is going to make those companies pay the government back. That's billions of dollars annually that could mean better services, lower costs, and more accountability in the system. So now let's talk about that second big update. This is one that affects everyone, no matter what kind of insurance you have. The Department of Labor, along with Health and Human Services and the Treasury, has just rolled out new steps to make healthcare prices more transparent. That means no more guessing games, no more shock when you open the bill weeks later, no more wondering if someone else got a better deal for the same care just because they drove a few miles farther to a different facility. Now, first up, the government has released what's called a Request for Information, or an RFI, on prescription drug prices. I know RFI sounds super technical, but it's basically a big request for feedback form. They're even asking the public to weigh in. So if you've ever been hit with a $100 prescription that probably should have cost you $10, this is your moment. Second, they've also issued new guidance for insurance companies and health plans that set clear, updated standards for how pricing data should be shared. No more messy, impossible-to-read files or infinite spreadsheets buried deep in the back of a website somewhere. This new guidance says the info needs to be clear, useful, and most importantly, understandable. This is helpful because it gives consumers like you the power to compare plans and prices without having to decode some mysterious spreadsheet. It's about making the system work for you, not the other way around. And third, there's a major update to the hospital price transparency rule. Hospitals will now be required to post the actual prices for their services, not just estimates. That means that when you need something like an MRI, a blood test, or even a delivery, you can go online and see the real costs up front. That's really powerful. You can plan ahead better, compare options, and avoid nasty surprise bills after the fact. It also pushes hospitals to be more competitive on their pricing, which could drive costs down across the board. Now, I know a lot of us comparison shop, right? We always know where to find the cheapest grocery stores or the cheapest gas stations, and now we'll be able to know where the most affordable healthcare is, too. So between clearer drug pricing, better insurance data, and real hospital costs posted online, it feels like this might actually help. This is supposed to be about making healthcare fairer, simpler, and more transparent so that you can feel more confident making decisions about your care. It certainly all sounds good on paper, but let's be real. Will it actually work? I don't know the answer to that. But I do know that we have seen some major shifts at CMS lately that show that they're serious about making some big changes to healthcare in this country, especially as it relates to Medicare and Medicaid. And just last week, CMS announced another big initiative. They're asking the public for ideas on how to use technology to make healthcare better, especially for seniors. They want to build a digital system where people can actually manage their healthcare online, find helpful apps, and understand their own medical data, which sounds great if it works and if the tools are actually accessible to people who aren't tech experts. It's also important to recognize that they're also talking about the implementation of AI in your healthcare, which I know some of you have already expressed very strong feelings about. In a recent press release, a deputy administrator for CMS said, quote, "The prospects for preventative care have never been stronger. Artificial intelligence is enabling providers to predict and spot health issues before they become symptomatic," end quote. No doubt they're also going to be using AI to help catch Medicare Advantage plans without overbilling. That's going to make those audits much easier because AI can scan huge amounts of data and flag when something seems fishy, like if a diagnosis doesn't match the care that was actually provided. So yes, we are seeing progress. We've seen big promises before, but if this works, it could mean fewer surprise bills and a system that finally makes a little more sense. So here's what you need to do. First, submit your feedback. The government wants public comments on the prescription prices. If you've ever been hit with an outrageous pharmacy bill, take the 2 minutes to fill out their online form and share your story because it can make a difference. Second, check your Medicare plan. Don't wait for CMS to step in on your behalf. They have a lot of work to do. You can call Chapter today to find out if you're on the right Medicare Advantage plan for your needs, and that will help you avoid paying more than you should. And of course, we always love it when you comment below. Tell us if you've ever tried comparing healthcare or prescription costs. Your story can help others, which is really impactful. And of course, you can also forward this video to a friend or family member who might benefit from this, or who might have something to add to the public comments that the government is asking for as well. And of course, don't forget to check out our other videos for more ways to save money and get free stuff.